Hey, good morning, and welcome to the UroPatient podcast. I'm your host, Vic Sidis. We meet every Saturday at 10:30 a.m. Central Time. And if you're watching us live, we're on YouTube and Facebook Live every week. And you can always watch our on demand by going to our UroPatient.com website, where you'll find all of our past episodes. Also, the best place to go to get any of our handouts, we've got a bunch of them, so go and check those out. Every program I put out, I have a handout with valuable information for you guys. So let's get started with our show this week. Hey, so I decided to do a little different show today. I've gotten a lot of comments on the comment box on stents. And I talked a little bit about them, and I've talked about kidney stones in the past. But really, the big thing that's been coming up is recurring is, why do they hurt so much? Why do they bother me so much? I've heard people complain that, this is the worst pain they've ever had and all sorts of things. So I thought this might be a good time to address stents a little bit and discuss them a little more detail as to why they're necessary, why they hurt, and what things could actually be done to maybe make things better, because you shouldn't have to be that miserable. So anyway, stay tuned for this episode. Let's go ahead and start it right now. So we're going to talk to you, as I said, about stents. They're really an essential medical device. They can cause pain and discomfort, no doubt about it. Now we're going to talk about their function and the reasons behind the pain and some potential solutions. So first of all, ureteral stents play a crucial role in maintaining the proper flow of urine in various medical conditions. Now this slide just kind of talks about some of their some of the causes and reasons that we need to have that available, such as kidney stones, tumors, post-surgical treatments. Little picture of what the basic anatomy looks like. Shows you that up on top, we see the kidneys up high. Those tubes that drain the kidneys are called the ureters. And then you can see that they drain into the bladder, and that's the storage organ for urine. And then you get rid of the urine. So it's the stents are going through those tubes called the ureters. That's where they fit. So let's talk a little bit more about this. So why are they necessary? Well, this slide explains in particular some of the complications and how they can help promote recovery. So blockage prevention, we'll talk a little bit more about that in the next slide. But kidney stones can block the ureters and cause a whole lot of havoc. Sometimes you have to do surgery on the ureters themselves, and they need time to heal, so they can kind of work as a way to help the healing process. And it can take some strain off the kidneys, because I'm going to talk a little bit about how they work and how there's a difference between the bladder and the kidneys in pressure systems. So let's get right into it. So one of the worst known pains to mankind is kidney stone pain. Yeah, ladies, labor and delivery is pretty bad, but kidney stones rank higher. And it's the reason it's so painful is when you block off a kidney, it will react to let you know that this is, could be life-threatening. Blocked kidneys can cause infections that can go to the bloodstream. They can cause kidney damage. So our bodies sense that and let us really know why they're blocked. So as we can kind of see in that diagram, that guy's not too happy. He's got a kidney stone, and that's some pictures of stones up in the kidneys, and we can see that that one is actually kind of blocking that tube, the ureter. Now, if you want to learn more about kidney stone treatments, go ahead and check out UroPatient.com. I got a couple episodes recently, 50 and 49. S-Wall, which is external treatment for kidney stones, and then other kidney stone treatments in 49. So it talks about some of the surgical procedures. But we're just going to highlight some of those things because we're talking about what the stents do in the healing process. So in this slide, we see a common procedure done for kidney stones that are stuck in the ureter. When they're low down, they can go up with a scope and grab the stones with these baskets, and sometimes they blast them with a laser beam to make them smaller and pull them out. But when you're manipulating inside that ureter, it's a small little area, you can damage it. You certainly can cause swellings. Like if you hit your thumb with a hammer, it's going to swell up. Ureter will do the same thing. Of course, if it swells, you're no better off than you were before with the blocked stone if you got a blocked kidney due to swelling from the ureter. So we have to do something to prevent that swelling. And then what we do is we place this tube called a stent. And that blue thing you see curled up there on the side is what a stent looks like. The other diagram shows what it looks like inside the body. So it has two curled ends so that it doesn't go up or down or fall out, basically. but one side curls up in the kidney, the other curls up in the bladder. And what it does is it basically provides like putting a straw through the ureter, and it keeps it open, physically keeps it open so it can't block. The stent is hollow and allows urine to travel through the stent itself. As long as you got the stent in, you're going to be able to relieve that pressure problem. Now, the stent does have that benefit, but it also has some of the reasons why it causes so much of this pain that people are writing about. So what are some of the sources of pain? Well, physical irritation. That stent rubs against the bladder, rubs it around in the ureter. That can cause some pain itself. Reflux, we're going to talk about that, the backflow of urine due to stent placement. Normally, urine never flows upward in the ureter, it only comes down. And I'll talk to you a little bit more about why that is. Muscle spasms, the bladder and the ureter really don't like that catheter, that stent in there, and they want to get rid of it. And sometimes that's what it'll do, is go into spasm trying to get rid of it. Those spasms are very uncomfortable. Some of those can be prevented, though. And there is a slight increased risk of UTIs with a stent in place. So let's talk a little bit about all that. So let's start with talking about some basic issues with the kidney. So as I got a little pressure gauge there, and there's the kidney, you can see that the kidneys are used to working under what we call low pressure. They should never have to push against high pressure. So we see that this is a happy kidney. The pressure is really low. Now, in contrast to that, in order to urinate, the bladder has to generate pretty high pressures. So if the bladder's pushing high and the urine's allowed to go back up the stent, it could cause high pressure into the kidneys. Not a good situation. So this is what we have in normal life. The bladder has the high pressure when it's squeezing urine out, and then the kidney still stays at a low pressure. And why is that? Well, and I mean, this is kind of crude pictures, but I think it gets the idea behind it through. The kidney the bladder has a valve where the ureter enters. It's a one-way valve, and it stays shut. So when the bladder squeezes, the valve shuts, and then urine can't travel back up to the kidney. When the bladder quits squeezing and it's back to a low pressure situation, the ureter can again transport low pressure urine from the kidney down into the bladder where it's stored. So that's the way we're built. So that's what we always wanted to have, is low pressure, like you see that valve on the top in the kidney, even when you're urinating and generating high pressures to expel urine. So this is what you don't want, and this is what happens in a stent. So you can see that ureter now has a tube going through it. So when you go to urinate, we have high pressure in the bladder, and high pressure goes to the kidney. Now that's what's causing that pain. When you start having, it's called reflux, urine refluxing up the ureter and causing high pressure in the kidney, it's going to let you know it's not happy, and it's going to cause that pain. A lot of what people are experiencing or complaining about, normally at resting, they're fine. But when they go to take to urinate, to empty their bladder, that's when they get that back pain. They feel it. And that's that urine traveling up. Now, I mentioned earlier, sometimes the bladder doesn't really like having a stent in it. And I'll talk a little bit about why that is shortly. But if it goes into a spasm, it'll generate high pressure. High pressure again, sending it up to the kidney. There's the cause of your pain. So what are the symptoms we get with a stent? Well, flank pain, that's what we're talking about. The flank is where your kidney's located. So you're going to get pain there anytime there's high pressure being built up. Frequent urination. I'm going to talk a little bit more about why that is, but because that stent's in there, it irritates something called the trigone. I got a picture to show you that in a second here. But that's going to cause the same problem. You're going to have that high pressure, frequent urination because of that stent being in there. Urgency to urinate, that goes along with frequency. It's like, I got to rush to the bathroom. Again, you're irritating the bladder. It's almost like when you have a urinary tract infection, if you ever had one, causes frequent urination and urgency. It's an irritant. The bacteria can be an irritant. The physical stent can be an irritant. Now, it's rubbing on the inside of the bladder, and it can cause blood in the urine. Perfectly normal. I see a lot of patients that call, or get a lot of patients calling, oh no, I have blood in my urine, something must be wrong. And we reassure them that it's not, it's normal. So if you know it's normal, then you're not going to be so worried. And you may have some burning sensation with urination. Again, all irritation from the stent. So let's talk about what I was mentioning, that trigone. So we call it the trigone. You can kind of see where that balled up stent is sitting right there on that little triangular shaped area of the muscle of the bladder. That's the sensor for when your bladder starts to stretch, so you know that you got to go to the bathroom. Well, you got that stent for some people just kind of bouncing up and down and banging on that trigone and giving you all those symptoms. So sometimes one of the treatments can be using a different type of stent that's maybe shorter and doesn't cause as much irritation to that area. So sometimes that can be a fix for it. Sometimes it's just going to be one of these things that calm the bladder down too with medications. So factors that influence pain's severity is going to be stent size and material. Certain stents are stiffer than others. Some are bigger than others, and the docs tend to make their choice based on what they're trying to accomplish. Your anatomy, the way you're built, can make a difference too. If you have an infection, that's not going to help things, or a stone is present and you're trying to bypass a stone with a stent. Again, those can cause issues. How active you are, if you're really active with a stent, and I'm not saying with a stent you can't be active, you can, but if you're really active with a stent, you're going to probably have more issues with this discomfort. So keep that in mind. A lot of patients notice more bleeding if they're active and they get worried about it. Again, I just, use good common sense, I guess. So how do we manage and treat the stent pain? Well, there are medications that can be given that'll help. These pain relievers, often things like Advil and stuff like that, are really successful. Even Tylenol can be helpful just to kind of knock that pain level down. Antispasmodics are huge. We use those to kind of keep the bladder from going into spasm. If it doesn't spasm, you tend not to have a lot of those same symptoms. There's something called alpha blockers. Those men that are older and that are taking these things for prostate relief, they can also help. They're muscle relaxers, so sometimes those can help. Talk to your doctor. There's a whole bunch of meds that we can typically give that can provide good relief if you're having a lot of symptoms. You do want to hydrate. You want to make sure that you're getting plenty of fluids through your system. More concentrated the urine is, the more irritating sometimes that can be. Avoid super strenuous activity. This is not the time to go out and do a marathon or crazy things. You want to be active but not strenuous. And then there are surgical solutions sometimes that have to be done. Adjusting the stent, removing the stent sometimes, changing the material. There's all sorts of things that can be done to try to make it more comfortable. I can tell you, and you may not be one of those who had a stent that was comfortable. I have some patients that have had stents that have very little discomfort with them. So it can happen. It's one of those things. It's a double-edged sword. You're trying to protect the kidney while irritating the bladder. So we go for what's best. Now, there are some innovations coming out. There is a stent, because those, as I talked about in those other things, the stents have to be removed, but they're not left in permanently. There are biodegradable ones, stents that'll come and break down and come out by themselves. You don't have to have anybody go in there to go after them. They have coatings that they can put on them that reduce the friction and may help be more comfortable. Again, adjustable length stents, there's sometimes just changing the size of the stent can make it better. So if you're really having a lot of problems, don't just suffer in silence. Let your doctor know. He can probably do something to make it better, he or she. And I think this is the thing that gets missed the most, and that's patient education. I see it all the time. Patients will complain that they're having all these issues, and they said they put the stent in. They never told me anything about it. I didn't even know. And even worse yet, you could have a stent in, and if you don't know you have it in, maybe it's not bothering you. You can leave it in there for, I've seen patients come back years later. We do an x-ray and find out they got a stent in. They said, I didn't know I had a stent in my kidney. It has to come out. So education is huge. I always say, let the patients know. We're going to have some handouts on stents in the UroPatient downloads area. So check those out. But you should be getting some instructions on it. And I think handouts are the best. Programs like this are big helps. So if you know what to expect, it makes a big difference, because you really need to suffer. There's all sorts of tips I mentioned for managing the symptoms. And I encourage you to talk to your doctors. They're the ones who put the stent in. They should be the ones dealing with all this. So make sure you have an open line of communication with your physician, your surgeon who put the stent in, what you should expect. Let them decide if they think it's normal or not. Again, good education is huge. If you know what to expect, most of the time it's a lot easier. I mentioned blood in the urine. A lot of patients will say, hey, I got blood in my urine. They never told me I would have that. The minute I tell them that's normal, it's like, oh, wow, what a relief. They know that wasn't something that they did wrong. So they know it's going to be okay. So stents aren't fun. again, I thought it was a great time to do an episode because I had so many patients that were sending in comments to me on stents and making, their own personal experience with it. Very valid. I haven't had a stent. I've treated patients for 40 years that have had stents, so I know what they're going through. But they're necessary. They're one of these things that you have to just kind of deal with. But again, if you know what you're dealing with, and be sure to let the doctor know, because there are medications we can give you to make it easier. Don't just suffer in silence. Hopefully that was helpful. We'll see you next week.